Well, welcome to our week 1, day 2, NURS 103 Skills Lab. The focus of this presentation will be on hygiene. Physical hygiene is necessary for comfort, safety, and well-being. Some patients will require some assistance in personal hygiene. Several factors affect patients' hygiene practices, such as culture and age. Good hygiene technique promotes normal structure and function of tissues. Proper hygiene care requires an understanding of the anatomy and physiology of the skin, nails, and the oral cavity, eyes, ears, and nose. During the time that you are providing personal hygiene assistance, spend that time to identify any abnormalities. Recognize that disease states creates changes in the integument, oral cavity, and sensory organs. So what are some other examples of how the skin and oral cavity show disease? Here's our first case study. During our skills sessions, we will go over questions related to the case study and also some quick quizzes within the PowerPoint presentations. Mrs. Winkler is a 58-year-old woman. She's living in an assisted living facility. Her medical history is MS, multiple sclerosis, she's diabetic, and her family has history of coronary artery disease. Mrs. Winkler uses a wheelchair, but recently has become weaker in the upper and lower extremities and unable to push her chair herself, needs assistance in transferring from the chair. So based on that, what type of assistance with hygiene do you anticipate Mrs. Winkler will need? Here's some additional information about Mrs. Winkler. She's been married 37 years. Her husband died suddenly 3 months ago of a heart attack. She does have 3 daughters who live nearby within an hour. And Mrs. Winkler says, I miss my daughters and grandchildren. I rely on them and am used to seeing them every day, but I don't want to be a burden to them. Mrs. Winkler wears full dentures. She complains that her mouth is sore when she wears her dentures. The skin have many functions, including protection, secretion, excretion, temperature regulation, and sensation. There are 2 layers, the epidermis and the dermis. So the subcutaneous tissue lies just beneath the skin, contains blood vessels, nerves, lymphs, and loose connective tissues filled with fat cells. Please review Table 39-1 on page 769 regarding functions of the skin and the implications of care. The feet, hands, and nails require special attention to prevent infection. The hand, in contrast to the foot, is used for manipulation rather than for support. The conditions influence that patient's ability to perform hygiene. Normal nails are transparent, smooth, and convex, with pink nail bed and white tip. Diseases cause changes in the shape, thickness, and curvature of the nail. Remember, healthcare providers, nurses, should not wear artificial nails because they harbor bacteria and can become invaded by fungus. The oral cavity is lined with mucous membrane, and saliva cleanses the mouth, dissolves food chemicals to promote taste, moistens food to facilitate bolus formation, and contains enzymes that start the breakdown of starchy foods. Remember, medications, exposure to radiation, and mouth breathing can impair salivary excretion. Exostomia is dry mouth, and gingivitis, inflammation of the gums, and dental caries, tooth caries. So why is care of the oral cavity so important? It's important when you are taking care of a patient and assisting them in hygiene to assess the growth, distribution, and pattern, which indicates general health status. Hormonal changes, nutrition, emotional stress, physical stress, aging, infection, and other illnesses can affect the hair. Sun chemicals and hair products, permanents and straightening and coloring agents can also affect the hair. The hair shaft itself is lifeless and physiological factors do not directly affect it, but however, hormonal and nutritional deficiencies of the hair follicles causes changes in hair color or condition. Remember to also consider ethnic hair variations. Eyes, ears, and nose. When caring for eyes, ears, and nose require careful attention. Clean the sensitive sensory tissues in a way that prevents injury and discomfort. Remember, try not to get any soap in the patient's eyes. And also remember that the sense of smell is an important aid to appetite. In addition, the time you spend with the patient during hygiene provides an excellent opportunity to ask if there's any changes in vision, hearing, or sense of smell is occurring. Continuing on our case study, Jamie is the student nurse that is assigned to help Mrs. Winkler. She reviews the effects of dependency on self-esteem of the patient and ways to give that patient opportunity to maintain self-care needs at an optimal level of functioning with assistance. This patient, Mrs. Winkler, is at risk for potential self-care deficiency, impaired skin integrity, impaired oral mucosa, and altered health maintenance. During the hygiene care, Jamie interacts with Mrs. Winkler to assess her readiness to learn and to teach health promotion practices. So think about what are some ways Jamie can help Mrs. Winkler maintain independence. There are many factors that influence a patient's personal hygiene. It's important to use communication skills that promote therapeutic relationship. And during the hygiene care, be sensitive to the patient's emotional status, health promotion practices, and also healthcare education needs. What are some factors that influence hygiene? Also, remember that be aware that the developmental changes influence the need and preferences for type of hygiene care. There are many factors that influence hygiene. We will focus on 8 of them. Social patterns, ethnic, family influences, and personal preferences. Very important because they dictate hygiene practices. Body image. Remember, a person's subjective concept of his or her body appearance and socioeconomic status also influence hygiene. Also, health beliefs and motivation. Cultural variables influence hygiene. Remember, the people from diverse cultures practice different hygiene rituals. Also, developmental stages, we'll talk about that a little bit more, but it does affect the patient's ability to perform hygiene care. Physical condition. If the patient is just really lacking in physical energy or their dexterity is impaired, it's going to impact their hygiene. A patient's developmental stage will impact and influence their hygiene. Skin is very sensitive in the neonate, and those patients going through puberty have active glands. And with the older adults, they may have thinning and drying that impacts their hygiene. Feet and nails, dry skin, systemic disease, different types of footwear problems, and chronic foot problems will affect their status. The mouth, teething, caries, gum disease, and edentulous. A patient that is shaving or going through puberty or aging, the hair is going to be impacted by that. The patient's eyes, ears, and nose. Remember that a patient's age, their developmental stage, will influence their hygiene status. Consider developmental and cultural influences. Be non-judgmental and confident. Apply the elements of critical thinking as you use the nursing process to meet patients' hygiene needs. Here's a quick quiz, and we'll go over the best answer during our skills sessions. You're caring for a non-English speaking male patient when preparing to assist him with personal hygiene. What should you do? Which one of these answers is the best answer? Continuing on, Jamie reviews knowledge about effects of chronic illness on the body image, independence, and she reviews principles of communication and the pathophysiology of multiple sclerosis, diabetes, and oral lesions. It is important to remember to provide patients with opportunity to determine how the nurses implement nursing care. Also remember what ethical standards need to be applied to allow Mrs. Winkler to make decisions about her care. It's important to always explore the patient's viewpoint. Always assess the patient's self-care ability, the skin, feet, nails, oral cavity, hair and care, and also their eyes and nose. Use of sensory aids. Do they use any hearing aids or do they wear glasses? Also, what are their practices of taking care of themselves related to hygiene and cultural influences? Be sure to review the tables and figures and boxes on pages 772 through 778 in your textbook. Nursing assessment. So as the patient is brushing his teeth, you can see that the student nurse is observing. During such observations, the nurse can determine how much assistance the patient needs. Remembering it's important to always learn patients' preferences, Jamie learns that Mrs. Winkler likes to have her face and hands washed first, then her teeth brushed before breakfast. Then she tells Jamie that it really is not important. Mrs. Winkler says, I'm not going to have breakfast today because my mouth is sore. I took my dentures out yesterday. They hurt my mouth too much. Can't wear them anymore. Jamie determines that assisting Mrs. Winkler with oral care is a priority. So what are some assessment questions Jamie could ask Mrs. Winkler and other assessment tasks Jamie could perform? Some common nursing diagnoses associated with hygiene are activity intolerance, bathing self-care deficiency, impaired oral mucosa membrane, risk for infection. Use the patient's actual alteration or the alteration for which they are at risk. Remember to review box 39-4 on page 779. Mrs. Winkler tells Jamie she wants to be able to wear her teeth and feel clean. Mrs. Winkler reports now mouth pain and sores, and Jamie examination reveals reddened oral mucosa, sores, patchy white lesions, and thick coating on the gums and tongue, and some bleeding from swollen tissues. Mrs. Winkler shares that she has trouble holding her arms above her waist and trouble holding small things like a brush because her muscles are so weak. So what nursing diagnosis would be appropriate based on this additional information? Nursing process planning. Goals and outcomes. Partner with the patient and the family. Make sure that they're measurable, achievable, realistic, and individualized. Set priorities based on assistance required and the extent of the problem and the diagnosis. Teamwork and collaboration. Healthcare team members, family, and community agencies. Remember to use teamwork for a more comprehensive care for the patient. And so, what are some examples of outcomes of skin hygiene? Be sure to review Care Plan on page 781 and 782, and also Figure 39-3 on page 779. So as we can see, Jamie has done a great job in determining goals. Knowledge, illness care. Mrs. Winkler will verbalize prevention and routine oral and denture care by the time of discharge. Oral hygiene. Mrs. Winkler will have return of intact oral mucosa within 1 week. So what expected outcomes would you suggest to accompany these goals? The next part of our nursing process would be implementation. Use caring to reduce anxiety, promote comfort, administer meds before hygiene, and be alert to the patient's anxiety, and also prepare the patient and to perform independently as possible. Teach techniques and signs of problems. Inform patients about community resources. Health promotion would include make instructions relevant and adapt instruction to patients' facilities and resources, teach the patient's way to avoid injury, reinforce infection control practices, and also hygiene measures vary by patient needs and healthcare settings. Remember that, and also when teaching patients about hygiene, include assessment of patients' knowledge, motivation, preferences, and health beliefs. Adapt items for safety and comfort, include safety risks and tips, determine understanding of infection prevention practices. Remember to always consider normal grooming routines and individualized care. There are different types of bathing and skin care. Always check the physician's orders, and sometimes a back rub or foot rub really helps relax a patient and also help them to sleep. Please review in the text page 783, box 39 5, as well as on page 784 regarding types of baths, and box 39 8, signs of peripheral neuropathy or vascular insufficiency. These are some key bathing guidelines. Remember to always provide privacy, maintain safety, maintain warmth, promote independence, and always try to anticipate needs. Make sure you have the resources that you need before you begin. Oral hygiene. Remember to floss the patient also, but be gentle. Try to avoid any injury or discomfort. Patients with special needs, remember, like diabetics, artificial airways, or if they're unconscious or if they're having chemotherapy, you need to adjust your hygiene routine practices. Please review box 39 9 on page 786, focuses on older adults regarding oral health. Denture care can be delegated to a nursing assistant. Instruct them to inform you of any cracks in dentures, and if the patient complains of any oral discomforts, and if there's any lesions in the mouth. Please review page 787, box 39 10 on the procedural guidelines of care of the dentures. The hair and scalp care. We will go over hair care and combing and shaving and skills. Remember, a person's appearance and feeling of well-being often depends on the way their hair looks and feels. Some patients can sit in a chair to be shampooed in front of a sink over a wash basin. However, certain conditions such as eye surgery, neck injury, limit bending. In these situations, teach the patient and family the degree of bending allowed. The skill of shampooing hair can be delegated to a nursing assistant also. Instruct them about precautions needed in positioning the patient. Inform you if the patient reports neck pain or have any new skin lesions. Please review box 39 11 regarding the procedural guidelines of shampooing hair of patients who is bedbound. Shaving. Remember that to shave facial hair after the bath or shampooing, shave in the direction of the hair growth. Patients prone to bleeding need to use an electric razor. Facial hair of African Americans tend to be curly and becomes ingrown unless shaved close to the skin. So what's the best answer for this question? A young girl with long hair is experiencing a problem with matting. The most appropriate action to take would be what? Give special attention to cleaning the eyes, ears, and nose during routine bath and when drainage or discharge accumulates. Care focuses on preventing infection and maintaining normal sensory function. Because of the cost, be careful when cleansing glasses and protect them from breakage or other damage when they are not worn. There are different types of hearing aids, and we'll go over some of the most common ones. When nasogastric feeding or intertracheal tubes are inserted through a patient's nose, change the tape anchoring the tube at least once a day. Please review box 39-12 on page 790 regarding patient teaching contact lens care. To remove an artificial eye, retract the lower eyelid and exert slight pressure just below the eye. To insert the eye, retract the upper and lower lids and gently slip the eye into the socket, fitting it neatly under the upper eyelid. Store an artificial eye in a labeled container filled with tap water or saline. Some artificial eyes are permanently implanted, whereas others must be removed for cleaning. Be sure to check the patient's records. So we're going to just review three of the most common hearing aids. This one is in the canal, or the ITC. It is small, it's the least visible, it's easy to manipulate, not interfere with wearing glasses or using the phone, and you can wear it with pretty much most physical exercise. This one is the in the ear, the ITE. It fits external to the auditory canal and allows for more fine tuning. It's more powerful and stronger. It's easy to position, adjust, does not interfere with wearing glasses. This one is behind the ear, BTE, the largest of them all. It's useful for patients with rapidly progressing hearing loss or manual dexterity difficulties, or those who find partial ear occlusion intolerable. Also, in the implementation stage, be aware of the patient's room. Maintain comfort, be aware of the temperature and the noise level, the lighting, the ventilation, and any odors. We will review in class occupied and unoccupied beds. So what are some sources of unpleasant odors in patient rooms and how can they be managed? Review box 3914, page 795 regarding procedural guidelines making an unoccupied bed, and also table 39-6 on page 794, common bed positions. This is a picture of a typical patient room, and identify and list features in the above image of typical hospital patient rooms. Sometimes to avoid any pressures under the heel or due to surgery or some medical interventions, you'll see these different types of foot boots. Whenever you use comfort or positioning equipment, check agency policy and manufacturer directions before application. So A is a foot boot, and B is a picture of a foot boot with lower leg extension. This is an image of a nurse instructing patients in the use of call light and bed controls. It's important to be familiar with the use of bed controls. Always practice when there is not a patient in the bed, so you can understand how to put the foot up or the bed up or the head of the bed. Maintain the bed height at the lowest horizontal position when the patient is unattended. Always remember the call light needs to be nearby within arm's reach. When changing bed linen, follow principles of medical asepsis by keeping soiled linen away from the uniform. I have seen many times where I'll see a nurse or a nurse's aide holding pillows or clean linen right against their chest. That is contaminated. Always remember of principles of asepsis. To avoid air currents that spread microorganisms, never shake the linen. If clean linen touches the floor or any unclean surfaces, immediately place it in a dirty linen container. Here's an image of a surgical or recovery bed. The top sheets and spread are not tucked or mitered at the corners. Instead, they are folded to one side or to the bottom third of the bed. This makes patient transfer into the bed easier. Continuing on with our case study, what interventions are appropriate for restoration of oral care? And what are your rationales to support your interventions? For example, intervention: remove, clean, and do not replace dentures except for meals if desired. The rationale for that intervention is this promotes healing during cases of mild to moderate stomatitis. So what other interventions should Jamie incorporate into Mrs. Winkler's daily hygiene routine? The next step of the nursing process is evaluation. Remember to always evaluate during and after each intervention. observe for any changes in patient's behavior, and always consider the patient's perspective. Often it takes time, repeated measures, and a combination of interventions for improvement. Ask yourself, has the expectations been met? Has the patient's expectations been met? Ask questions to determine appropriate changes to interventions. So, what are some examples of questions to ask to determine whether expectations were met? So, Jamie does ask Mrs. Winkler about reporting of symptoms, and Mrs. Winkler states she now knows that her oral discomfort and sores are related to how she cares for her dentures, and she will report any symptoms if they reoccur. Achievement of outcome is shown because Mrs. Winkler is able to participate in prevention of oral problems by reporting symptoms indicating a problem. Remember, again, one of our goals is always to support and promote independent care. What other questions should Jamie ask Mrs. Winkler, and what else should Jamie do? So here are some quick safety guidelines. Always communicate clearly with the team members. Remember, we want to promote collaboration. Also incorporate patients' priorities, their preferences. Move from the cleanest to the less clean areas. Use clean gloves for contact with non-intact skin, mucous membrane, secretions, excretions, or blood. Test the temperature of the water or solutions before, and use principles of body mechanics and safe patient handling. Be sensitive to the invasion of privacy. Remember, when performing skills related to hygiene, what should you as a nurse remember to do to ensure safe, individualized patient care? Always be considerate the importance of understanding patient preferences and incorporating their cultural practices. We will review some of the basic skills in our skills lab and also the case study questions and the quick quizzes. Please be sure to review the assigned reading in your textbook.